Sri Lankans growing lax about safety? As the country grapples with its third wave of COVID-19 infections, it's time to ask ourselves whether we're doing all we can to stay safe. Are we being responsible enough?
Now we are into the pandemic, basically into three waves, and so this has an impact on people, and there is something called pandemic fatigue in many countries, not only in Sri Lanka. After some time people get tired of wearing masks and practicing social distancing and things like that, and maybe at least some sections of our population are experiencing that situation.
A phenomenon being observed globally. Many countries are reporting signs of pandemic fatigue in their populations, defined by the WHO as demotivation to follow recommended protective behaviors, emerging gradually over time and affected by a number of emotions, experiences, and perceptions. Pandemic fatigue is an expected and natural response to the pandemic, which has impacted the daily lives of everyone, including those who haven't been directly affected by the virus itself.
What happens is that people are isolated for extended periods of time, and then you give a little break and then go out in big numbers and do shopping and completely disregard social distancing.
The mental health effects caused by long periods of isolation are significant contributors towards pandemic fatigue. This, coupled with financial struggles amidst numerous island-wide lockdowns, can lead to behavioral shifts, such as an increasingly lax approach to safety.
There are more immediate concerns. They are more concerned about day-to-day earning and making enough money to buy food for the day. So health may still be a concern for them, but it is a more distant goal.
To address and mitigate the effects of pandemic fatigue, the WHO has proposed 4 key strategies: understanding people, engaging people as part of the solution, allowing people to live their lives with reduced risk, and acknowledgement of the hardships people are experiencing.
In Sri Lanka, we don't do big surveys like in the US. They do various national surveys asking people's public opinion about issues. In Sri Lanka, unfortunately, we don't do it. So as a result, we don't fully understand the constraints that different people are facing. People at different levels should speak, what difficulties they have, because we cannot assume that everybody will be able to follow it in the same way, because they live different lives.
With these limitations in mind, how can Sri Lanka address the widespread issue of pandemic fatigue and encourage individuals to follow safety measures more responsibly?
This is not a easy problem to solve, because we are encountering it for the first time. There has to be more space for people to make decisions at the provincial level and maybe at the Pradesh Sabha level, so that they will know local needs and respond to it satisfactorily.
However, according to Professor Silva, the responsibility of ensuring public safety does not lie solely in the hands of the government.
Also working with these different communities and giving them the right message, I think is very important. This area where I think civil society organizations also have a big role to play. In many countries, religious leaders have been mobilized to communicate messages in the way which is easily understood by their followers. It's important that if you are talking about safety masks or medical masks, everybody should wear that irrespective of who they are. So they should set an example. So you cannot have exceptions to this rule.
Staying safe is ultimately a responsibility that falls on each of us as citizens. Adopting better mental health practices can help us take control of our thoughts and actions, embrace more responsible behavior, and help uplift others during this prolonged time of crisis.